In this video, we want to introduce you some terminology about hymen surgery. But before that, we want to tell you some basic knowledge about the hymen. By the way, welcome to Anatomynote YouTube channel. The hymen is a thin piece of mucosal tissue that surrounds or partially covers the external vaginal opening. There's no real medical purpose for the hymen, although some think it may have evolved to help protect the vagina from infection. There are more than 10 types of hymen shapes that women born with. Some are common and some are rare. But you must know some women are even born without a hymen. Even so, in many cultures, the hymen is considered a token of virginity, and for cultural and religious reasons can be an important factor in a new marriage. So, reasons for seeking hymen reconstruction surgery are varied and may be physical or psychological. Most people say hymen surgery refers to hymen repair or hymen reconstruction. But in medicine, hymen surgery also refers to as hymenorrhaphy. Hymenorrhaphy. This is a general term for hymen surgeries. Hymenorrhaphy or hymen reconstruction surgery is the temporary surgical restoration of the hymen. The term comes from the Greek words hymen meaning membrane and raph meaning suture. It is also known as hymenoplasty, although strictly this term would also include hymenotomy. Hymenoplasty. This is a repairing operation of hymenal remnant tissue for mimicking first sexual intercourse again. It can be done for small and long terms before the marriage. It's also considered in aesthetic genital surgery. It is not considered a part of conventional gynecological care, and is often classified as a plastic surgery procedure, mainly due to its lack of a medical purpose. It is therefore not widely available in hospitals, so patients need to go to private clinics to have the procedure done. Some hymen reconstruction operations are legal in some countries, while other countries ban all hymenorrhaphy. Hymenectomy and Hymenotomy. A hymenectomy is sometimes also called hymenotomy. It is a surgical procedure where an opening is created in the hymen. It is often used when a person has a hymen that is abnormally thick, septate, or otherwise obstructing the flow of menstruation. One example is hymenectomy for the imperforate hymen. Thanks for your watching. Our channel focused on facts about the human body in different aspects. If you don't want to miss these, you know what to do. Thanks again.